Hello, my name is Caitlyn Engel and I'm here to answer your burning questions for speech therapists. Our official title is speech language pathologists, and we are considered allied health professionals along with audiologists, occupational therapists, physical therapists, respiratory therapists, and so on. Our first question is, what is your favorite part of working home health? I love the flexibility that comes with home health personally. The scheduling is very open, and we work with very closely with caregivers and parents of our kids to make sure that their needs are being met and move around and adjust to their schedule. So it's very personal and preferential for our families. And the best part is we get to do therapy from the comfort of their own home. So we get to see them in a more natural, less sterile environment. My second question is, what are some signs that a child may need speech therapy? And I think that's a question that we get asked most of the time. And the answer is it does depend. So there are developmental milestones that a child should exhibit at each stage in their young lives and their development. And we look to see how delayed these milestones are. So typically we expect 2-year-old children to produce about 50 words and to be about 50% intelligible, meaning that you understand 50% of what the child is saying. This of course may vary. So if you are unsure, speak with your child's primary care provider and see about setting up a speech evaluation, and we can dig more deeply into the background there. Third question is, where did you get your degree from? So to become a speech language pathologist, you do need to obtain a master's degree in the field. And I graduated from the University of North Texas in Denton with my bachelor's degree in speech language pathology. And then I journeyed down to San Antonio, where I received my master's degree at the University of Texas Health Sciences Center at San Antonio. My next question, what are your goals as a speech language pathologist? So my goals as an SLP is to go into each therapy session with a holistic and functional approach. I want to ensure that I am targeting functional aspects of these kids' lives so that it's relevant to them and their family, and their community, their home, their school. I want to be well-rounded and educated enough to never turn down a challenge. My next question, what made you become an SLP? Well, I was fortunate enough to declare speech pathology as my major in my junior or senior year of high school. I had to put a lot of faith into the potential that speech pathology had as a career because I had yet to take any classes in the field or related to the field at that point. I saw how much of a difference this field can make in the lives of not only children, but young adults, mature adults, and even geriatrics. Next question, by what age should a child be speaking over 100 words? I would say by age 3, we would expect a child to be using 100 words or more, but again, it does depend on other factors. Last question, what causes a speech delay? So we don't know what definitively causes a speech delay outside of certain conditions, such as certain medical diagnoses like Down syndrome, autism spectrum disorder, cerebral palsy perhaps, numerous conditions, genetic or acquired, are definitely risk factors. And some other risk factors, however, do include low socioeconomic status or living in poverty, essentially, prematurity at birth, ear infections, poor nutrition, and substance abuse during pregnancy. Those are just some of the few. There are some more risk factors, single parenthood, low kind of paternal education, just things like that. Those tend to be risk factors, not necessarily causes, because we can have, of course, prematurity, ear infections, poor nutrition, and the child does not have a delay. But those are some of the correlations that we see between the two. Lastly, on the topic of ear infections, please make sure that you get your child's hearing checked and screened after their newborn screening, because although many newborns pass their first hearing screening, it is beneficial to get it checked again, usually around age 5, when they're about to go into school. If we don't hear properly, it can affect our language development. So get your kids' hearing checked. Thank you so much for submitting these questions, and I hope that my answers are able to provide you with a better understanding of what it is that we do. Next week, our Q&A will be with the PT, Kaylee Adams, and you will not want to miss it. Thank you so much.